DocTalk Show. Male and female infertility. Take note of the telltale signs.
That doesn't rule out the fact that the man doesn't have a problem.
Even still, with the females, we tend to have other problems. Some of them are hormonal, yeah. Some of them are hormonal.
A woman is
some are
basically made of
metabolic, like what we call polycystic ovarian syndrome. Yeah, some people don't have their hormones balancing, so they cannot adequately have a healthy cycle to allow them conceive.
Yeah, because generally the female reproductive cycle is managed and controlled by hormones, and even conception itself. For you to get pregnant, you have to have particular hormones at a particular time of your cycle. So if your hormones, what Dr. Jaffa is saying about is if your hormones are not regularly moving at the time we expect to increase and reduce at the time we expect them to, then there are possibilities.
Of course,
that
outwardly you will see that such mothers will have a problem with their menstrual cycle.
And again, I think very importantly, it's timing. In our African societies, we find men with multiple women, 2, 3, or 4. So there are men who have developed a routine on when to see their women.
Yeah.
I
Monday,
see number
Tuesday,
1 Monday, Tuesday. I see number
But I think
2.
it must be working very well for you since you know the
Wednesday,
timing.
I'm getting there. So I'm still on 1, but I'll get there. So you find that some women have their regular cycles, and once a man draws a cycle that is consistent, that is regular, you might find that they get to the other partner when they are always in their safe days. So it's a problem, and it has happened. People have come to the clinic, and that is really the problem. How many women do you have? Then if you develop a regular pattern of when to visit those people, you always
You may
get to
never
the other
find
person.
a woman
Yes.
in her
And
ovulation
a
phase
simple
where she can
advice
conceive.
of twist that around and make it random. 2, 3
Things-
months and someone will get
Things
pregnant.
change.
So
Yeah, true.
yes, people have to be aware of their cycles,
of their cycle.
and when their spouses are expected to conceive. Yeah.
But sometimes we also have things like fibroids.
Yes, true. Fibroids are especially causing structural problems. You have fibroids disfiguring your uterus.
Yeah.
You cannot have a sperm or an egg.
They can bend,
bend the tubes.
The tubes, yes, or block them.
And provided anything that stops the sperm from getting to the ovum in the right environment will cause infertility.
Even these ladies who have had for example, they've conceived before and haven't delivered, and ended up with very bad infections after delivery. Those infections can go inside the uterus and even block their way, or even they can spread outside into the pelvis, and the tubes get adhered or get attached to other structures, hence bending or even blocking the tube.
Or very aggressive procedures of cleaning the uterus.
Yeah,
The
uterus.
uterus.
For
And then
example,
it heals by scarring and failing to actually contain.
Yes, then eventually you're having very painful periods or irregular periods or no periods at all. So those are very common scenarios.
We've had also mothers with this is a rare condition, this thing of endometriosis, whereby the normal endometrial tissue, the lining of the uterus, the inner lining of the uterus, the tissue which is supposed to line that grows in other places which are outside.
Like the intestines.
You can go on the intestine, even in the uterus itself or in the
The
tubes.
tubes.
They have
And
caused
on the
lots of
ovaries
problems.
as well.
And people come in, their main complaint, they're always in the clinic complaining of painful menstruation. Painful menstruation.
Very
but not
painful
knowing that maybe this could be the problem. Yeah.
Then we also need to talk about the fact that we have what we call primary infertility. That is for a woman who has never conceived and she's not being able to conceive. But we have secondary infertility. A woman has had children before and is looking for another child and has failed completely to have another child, even when she has had the child before.
Well, the causes are cross-cutting, whether primary or secondary. Usually, the causes can be the same. You can have your hormones misbehaving after the first child, but usually, commonly, it's a structural problem, either a problem with, a problem with your uterus or a problem with your tubes, following what we've talked about before, either infection or previous surgery. Yes.
Yes, but the problems are so many, but at least we need to give hope to these mothers. That with the modern I mean, this modern world we're living in, there's always a solution. Then of
Yes,
course, the only limiting factor could be.
You know, Dr. Billy, before we even
Sources.
have solutions for these people, we must emphasize that for any couple that is attempting to have a child, it is very important that the first contact to the doctor should come with your spouse.
Yeah.
I find it easy out of practice for me to first rule out if a man is able to father a child before
Because
even concentrate
the
on the
investigation in the man is always
It's very
It's very
so-
simple, very cheap, very quick.
And you know, these days men have, well, we have all gone wrong with our lifestyles. We don't exercise, we eat unhealthy foods. Now we have fast food restaurants all over the country. You know, smoking, alcohol, and all these cause problems in the male, even in the male reproductive cycle. And you find that a man is so obese, and just that obesity and everything that it causes in his body cannot allow him.
yes. Problems ranging from erectile dysfunction, then even production, your sperm quality could be very poor. You could have a good number, but most of them are useless sperms. They can't even swim.
They're
They're just there, two heads, and
They just rotate
Smiling
around
around.
like a drunkard.
They move in the same place.
they get the egg. They get the egg, and this thing just gets confused. Can't even penetrate anything.
Of
right?
course, men will tell you, I have a child somewhere. And most of the times you find that even that child they're talking about it.
Is not, doesn't belong to them. Well, we shall need to see what investigations, what examinations and tests can we do for these couples to help us know what the problem could be and be able to address it.
We have mentioned that, to me, I think the ideal thing is to first deal with the man. Whether they've had children or not, it's very important that you rule out a man so that you can, because when you're investigating a woman, it's costly, it's invasive, it's, you know, lots of things.
Yeah.
So if you're sure about the man, then you can handle
But
the
of course,
woman.
not forgetting that you are living in the African tradition, whereby you see a woman always wants. We are always.
The woman will always come alone
Yeah, and
first,
they always on the yes side of the situation.
the women. So when we
Yeah,
come back,
yes.
we shall see what investigations or tests can we do on a woman to once we've ruled out that it's not the man's problem. What investigations can we do to ascertain what the problem is and what we can help her to do for the couple to get a baby.